like, nope, 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 not dealing with that. Hi ladies, I am obviously out and about, so forgive any children or dogs that you hear in the background. Today is Thursday and I had my surgery, my D&C yesterday, early in the morning at 7:30. So about 24 hours post-op, and doing okay. To fill you in from the last update, got up bright and early yesterday with the husband, went to the surgery center. It was really easy, way better than last time. Checked me in, got me in really quick. The lady was reading me off, you know, all the questions they ask about, do you smoke and all, are you allergic to things, and she was like, and there's no students, you know, training today. And I was like, thank you, because last time a student tried to start my IV and it was just did not go well. And this nurse, while she wasn't the friendliest, she was really good, and took one look at my hand, it was like nope, and gave me my IV in my wrist, which I think is what they resorted to last time. So I was very thankful for that. The anesthesiologists were lovely, and my doctor actually got to do the surgery, so that's nice, because last time was just some random doctor I didn't know, because obviously my RE doesn't do that. Recovered really well. The only bits I super remember coming off of anesthesia was that my blood pressure had dropped really low, and they were talking about that and how my color was starting to come back as my blood pressure went up, and I don't know, I found that amusing because my blood pressure has been so low the last few weeks. Other than that, I did have quite a bit of pain. I didn't remember it hurting that much last time, and I also don't super remember like what meds they gave me last time. Whatever, this time they gave me prescription strength ibuprofen and hydrocodone. So yesterday I was using the hydrocodone to feel better because like the cramps were bearable, but when I was trying to move around, like even shift my position, like sitting, I was just getting really sharp jolts of pain. So I was like, nope, 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 not dealing with that. Did that. The husband stayed home and didn't really work except when I napped around noon. So yeah, he stayed home. We watched quite a bit of Silicon Valley. We watched some Westworld. I watched some Hoarders. It was just a pretty low-key day, which is why I needed to get out today. So thank you to all my friends who texted me and offered to pick me up, cherry limeades or whatever else I needed, or meet with me. That was really sweet. I did indulge in McFlurry from McDonald's, pumpkin pie smoothie from Scooters, and a Baja Blast freeze from Taco Bell over the last few days, so don't worry, I've indulged. And then last night my friends brought over a wonderful gift basket. I'll show you now. And it was just really sweet, and it really touched the husband a lot. He just didn't expect, I guess, anyone to do anything. It was nice to see him feel so supported. Before I went to bed last night, I did what I normally do for work, which is write down a to-do list. So before I leave work every day or get away from my desk, I write down what I'm gonna do tomorrow. And I just felt like yesterday was so worthless. I mean, obviously I had surgery, but I was like, I can't do another day where I just binge watch a show. So I wrote down a list before I went to bed of what I wanted to get done today, and I have to say, been very productive, which is good. I've also been mobile, obviously in a lot less pain. I switched over to the ibuprofen just because I wanted to be up and about today. Tidied the house, started a load of laundry, and loaded the dishwasher, called and made up my follow-up, my post-op appointment. Unfortunately, I have a week-long work trip when the week I'm supposed to go follow up with her, so I'm gonna have to deal with that afterwards, but that's fine. It should be fine. Emotionally, I'm fine. The husband said I did a lot better this time than last time, which I was having a hard time telling, so I'm glad he said something to me. I guess I more or less went kind of catatonic last time, so the fact that I was doing anything the last few days is better, but it also was a lot less hassle and a lot less pain because it did. I found out Monday, had my D&C on Wednesday, and I think it's better this time just because I think it's scary the first time you feel that devastated, like you've never felt that way before and you're kind of afraid that it's going to be that way forever, and this time at least I knew it would stop, so I think that's helped a lot. And just knowing kind of how dealing with this strong of emotion works, like you can't stay that way for very long, and then it kind of ebbs away and you have a sort of normal day, and then your I guess capacity to feel that sadness again builds up throughout the day. Maybe something triggers you at night. So it's good to know that now. Anyway, I don't know if any of that made sense. We did talk a little bit yesterday about our game plan going forward, just because it makes me feel better. Husband is very much a one step at a time guy, and I'm a programmer. I need to be able, I used to think I was type A, but I'm not really type A. It's a little bit different. I don't need to control everything. I just need to be prepared for everything, because in programming, it's a bunch of, if-then statements. If this happens, then do this. If this happens, then do this. And I think that's how I'm kind of dealing with this situation. So we talked over all the ifs last night. It depends a lot on what the genetic results come back, as well as whether or not my RE agrees that we can do IVF and my fertility insurance agrees that I can do IVF. I think we're both overdoing hybrid cycles right now. I don't have much more endurance left in me. It's been over a year and a half of either being on medications or being pregnant, and unfortunately I'm not in a job right now where I can just coast along and do what I've always done. Like, I really need to step it up and learn. I was hired for this position on the premise that I could learn what I needed to, not because I was already capable of doing it. I can't be incapacitated, month after month after month with meds. So I'll let you ladies know as soon as we get those results back. Once we get those back, then I'll make an appointment with my RE to sit down with her, and also call up the number for the fertility insurance and talk to them to get that started. The fertility insurance also does consultations for adoption, so I might chat with them about that as well. Anyway, that's how it's going now. I'm gonna go tackle the rest of my to-do list to keep myself busy today. Bye ladies, keep on fighting.